Okay. Welcome, everybody. Good afternoon, and welcome to this March session of Breaking the Silence, organized by AshaUSA. So, we have been organizing a monthly speaker series focused on various topics, various taboo topics. And we are sort of trying to start a conversation about these various topics. So, today we are going to talk about managing mental health and specifically depression during the COVID 19 pandemic. As we are all aware, COVID 19 pandemic has caused a worldwide mental health pandemic, and widespread disease, death, loss of routines as we knew it has had far and wide implications for every aspect of our daily living, whether it is work life, family life, in general, health and emotional well being. So, for so much of a loss for such a prolonged period of time, has definitely had a negative effect on all our mental health. And add to that the experiences of weather extremes due to global climate change, floods, snowstorms, extreme cold fronts, droughts, forest fires, the racial justice movement that sparked a chord worldwide after the murder of George Floyd in Minneapolis last May, which started right here in our Minneapolis neighborhood. And we just got over the tensions surrounding politics and national elections that stirred the consciousness about race relations. To add to all this stress, we have a 24-hour news cycle and constant access to social media. All this has definitely taken a heavy toll on our health. In the context of this backdrop, are you feeling sad, irritated, upset, or angry? Have all these factors affected your sleep, your appetite, your energy levels? Are you depressed? Whether you are a college student in the middle of a major slump, a new mom who can't pinpoint why she's feeling so glum, or a retiree grieving over the loss of a loved one, that question isn't an easy one to answer. But there's one thing for sure about depression, that it is much, much more than just a sad mood. So, today, to talk about this topic, we have a panel of experts with us who are going to help us shed light on the topic of depression. What is it? Who can get it? And what can we do to get treated? Let me introduce you to our panel of experts. Dr. Vibha Kurdikar is a psychiatrist at Park Nicollet in St. Louis Park, treating patients age 18 and over. Hello, Vibha.
Hello, thank you for having me.
We have Sue Abderholden. She's the executive director of NAMI, Minnesota. NAMI stands for the National Alliance on Mental Illness, which is a national advocacy group originally founded as a grassroots group by family members of people diagnosed with mental illness. Welcome, Sue.
Thanks so much for having me today.
We also have with us Dr. Sonal Markanda. She is a licensed psychologist and works in the area of trauma and mood disorders with adults and teens using a systemic approach and cognitive behavioral therapy. Welcome, Sonal.
Hi, thank you for having me too.
Thank you all for giving us your valuable time and expertise today. Let's start by some basic questions about depression. So, can you talk a little bit about what is depression? What are some of the signs and symptoms that you look for when you diagnose depression?
I can take that. So thank you for talking about this very important area that affects all of us on a daily basis. This year has been especially difficult because of COVID, and I think some surveys have shown almost a threefold increase in depression in people from all walks of life. So again, like your question is, what is depression? So it's really, important to distinguish that this, depression is not just a feeling of sadness or loneliness. I mean, that happens to all of us all the time, depending on what's going on in our lives. There's always stressors, ups and downs. But depression, clinical depression, as we call it, is really a sustained state of mood that is sad mood, feeling of despair, feeling, lacking joy, lack of interest in things that you previously enjoyed doing. And this, to diagnose with major depression, we really see if these symptoms are lasting at least 2 weeks or more. And sometimes the sadness can present as irritability or just not lack of joy, not just sadness per se, as we all know it. And usually this sadness or mood changes is accompanied by many other syndromal symptoms such as disturbances in your sleep. So either sleeping too much or getting up early in the morning, appetite changes. Some people just don't feel like eating and they lose a lot of weight. Some people eat a lot and that's their coping mechanism, and then they may gain weight. There's biological reasons why that can happen as well. Low energy and motivation, slow movements. Sometimes people will say they're just family members will say they're just moving very slow, or they're just not being able to do things as fast enough. And sometimes people will have feelings of just pervasive guilt, low self-worth, feeling like they're never going to feel better, things are never going to get better, and this feeling of loss of control, really, that they don't have control over their emotions. And that's what brings about these feelings of just helplessness in them. And when symptoms of depression get really severe, people can feel like, it might be, maybe it's better off if we weren't alive. Maybe people around us would be happier if we weren't there to create this burden in their lives. They start thinking about, what is my point of being here? What am I doing? What am I achieving? So this, feeling like their life has no purpose, and they might start having suicidal thoughts, or just not wanting to live. And then depending on, what the perception of depression or your idea of whether that's accepted in your culture is or not, a lot of my patients sometimes will come with just chronic vague symptoms like chronic pain, aches and pains, digestive problems, headaches, neurological problems like dizziness, and when they go to their primary care doctors or even specialists sometimes, and there'll be no clear physical cause of these, then their team will start exploring, is there something else? And then they'll send them to us. And then more deeper conversations will happen that we can uncover really what's happening in their lives. But the key point here is all of these symptoms, how disruptive are they in your life? I mean, a lot of my patients will come and say, well, am I really depressed, or am I just sad because, this is happening in my life? But I'm still going to work. I'm still doing what I need to do. I'm still getting the kids on the bus. I'm still, cleaning the house. But the key question to ask is, how hard is it? How much of energy is it taking for you to be able to get all this done, for you to be able to just wake up and get going in the morning? For us, for people who don't suffer from depression, that's just routine. We get up in the morning, we do what we need to do, we go to work, we take care of our families, and we come back. But for someone with depression, even that first step of getting out of bed can take a lot of effort. So the question we ask usually, if we determine how severe this depression is how hard is it, and how long has it been this hard? So that's really, the difference between just feeling sad and down because something has happened, and how do you determine that it's really something that you need more help for, or you need treatment for?
Yeah, I think that's a very good point, especially in the South Asian community. It is well known, and research has shown that it comes across as psychosomatic, where people are more focused on their physical symptoms and go to the doctor for physical symptoms, and it turns out that they might have a mental health issue. going on. So yeah, that's important to know. And again, either you or Sonal or Sue can answer this. What is the age when it starts, or when do we commonly see people developing depression? Do young kids get depressed, or is it teenagers, or can you tell us about that?
I can answer some of that. I think that, especially with today's society, since there's exposure and to so many different things as far as media goes, and then developmentally, everybody's trying to meet different stages. You can see the manifestation of depression across the population, the spectrum. And so I think, you can sometimes see it with little kids, and they tend to also sometimes present with more somatic symptoms, especially if they're pre-verbal and they don't have the language for the emotions to say, I'm sad, I'm this, I'm that. And that could be anything related to problems at school, untreated, maybe learning diagnoses or disabilities, conflict within the home with the parents where they're dependent and reliant on their caregivers who may or may not have stable functioning. I think you see that with adolescence, just because that's such a critical time of development and identity formation, the susceptibility to peer pressures, trying to find out who you are, where you're trying to go, the transition, obviously, from young adult to adulthood, moving, marriage, new jobs, all those different factors, especially as you get older, dealing with maybe your children leaving, dealing with chronic health conditions, dealing with, Eric Erickson describes the developmental stage of generativity versus stagnation is once you get towards closer to the ender of life is what is the meaning, that you have left to impart. So I think across the board, anybody is susceptible to depression.
Yeah, so irrespective of age, irrespective of other factors, what about gender? Is it more common among girls versus boys, or women versus men?
So I was reading some research that shows like women and girls are more likely to receive mental health services, but that's not necessarily an exact representation. It could just of the prevalence. It could be more equal, but women and girls may be more tending to seek help because it may be considered to be more socially appropriate. And for males and for boys, it might manifest otherwise, in the form of internalizing disorders such as maybe substance use or ADHD or conduct issues or something. So, I do think that it depends, kind of what both of you were saying, that it may not always present as what it looks like at first.
Yeah, so there are gender differences in how it shows or how is it is expressed. Like for example, anger. Boys might more express it with angry outbursts or aggressiveness, whereas girls might go in. So there are gender differences. So that's good to know, especially for parents to keep an eye on their kids' moods and behaviors. Um, and we always hear about different kinds of depression. So Vibha mentioned clinical depression and how that is diagnosed. We hear about postpartum depression. We hear about seasonal affective disorder, which is also a kind of depression. So basically, that is affecting different age groups at different times in their lives due to various factors. So, can anybody or all of you, talk a little bit about what are the causes? We talked about, these external things happening and we are affected, for example, the pandemic. But other than that, are there any biological factors or any other factors that lead to depression?
Yeah, absolutely. I mean, depression is a biologically based illness. Of course, the causes are multifactorial. There's no one thing that you can pinpoint, and research is still ongoing with the exact reasons for why depression happens and presents differently in different people, or why they respond to medications differently. But I mean, we have identified genes that make people more vulnerable to depression and influence how they respond to medications or treatments. There's specific areas of our brain that we know regulate mood and emotions, and so basically we have neurochemicals or chemical messengers in our brain that help transmit messages between our nerves. And so we've we've seen through various, now we have imaging like SPECT imaging or functional MRIs that actually show us different parts of our brain that are activated when different emotions happen. But what basically we see is that these messengers are responsible for transmitting messages through neurons between these areas of the brain that regulate our mood. And that's where the focus of the treatment really is. So that's the biological gist of what can happen. Again, nowadays, inflammation we've seen is one of the theories that they're postulating, that how much is inflammation in your brain really responsible for mental illnesses. So that's one of the other theories, but really so many other factors, genetic vulnerability, familial disposition to, if you have a family member, first a family member, then you can be at more risk of developing that. Stressful life events, especially childhood trauma, makes you more vulnerable to developing depression. Other big life stressors can contribute to that too. I'm not saying causation per se, but definitely if you are vulnerable to it, then you can end up, showing more symptoms of that. Substance abuse, using alcohol and drugs, we know can affect different areas of our brain that regulate your mood. And so you may not have clear symptoms, but then once you start abusing alcohol or drugs, then you start seeing more of those symptoms, or the substances can directly cause some of these symptoms as well. So we want to, when we evaluate patients, we need to rule that out. Chronic health conditions. Chronic health conditions can also affect it, such as thyroid disorders can present as depression or anxiety. We check for vitamin D levels. We can, Parkinson's disease and other neurological illnesses, post-stroke, people can present with depressive symptoms. So there can be a lot of different causes for depression, but we really can't identify one thing, which is why we kind of treat the environmental and genetic and biological causes all at once. I don't know if Sonali wanted to add anything else.
Sue could also speak to, one thing Minnesota has looked at, and, obviously it's a national study, is the role of adverse childhood experiences. They call it ACEs. And so there's been, longitudinal studies that over time show the exponential, increase sometimes for depression, other risk, other disorders, physical or mental health, because of exposure to certain environmental stimuli, like such as, if you've ever had a parent that went to prison, if you've ever experienced any type of mental, physical, emotional, sexual abuse. For example, there's a quiz that you can take that lets you know what is your ACEs score. And I think above the number 4, you begin to see like exponential increases. So I think, there's plenty of research out there, and the focus is also hopefully towards a bit more preventative measures versus reactive measures, and this research is great in helping towards that.
Yeah, so looks like just like we have family health history for chronic conditions and medical conditions, we need to share our mental health history with our family members as well. So, if your grandparent or parent has depression, or an aunt has clinical depression, you need to know about it, because genetically you might be susceptible. Your kids should know about it, just like we talk about diabetes and heart disease. I think people need to share that history as well. Sue, would you like to tell us about some of the factors that, especially during the pandemic, that have exacerbated depression among different family members? Because you have support groups for families with mental illness. So can you talk a little bit about that?
Absolutely. We're actually having kind of a normal reaction to an abnormal world. And I think during this time, I bet pretty much everyone has experienced several days of depression or anxiety because of it. When this all started a year ago, we all kind of hunkered down and we said, okay, we can make it, it'll be May or June. And then we realized it wasn't going to be May or June. This wasn't a sprint, this was a marathon. And that's really hard for our brains, right? To all of a sudden kind of make that huge shift. And then there was just this general uncertainty because no one knew when this was going to be over. And you didn't know how you would catch it. You didn't know if there'd be a vaccine in time. I mean, it was then we're not built to deal with that kind of uncertainty for that long period of time. So I think that was huge. We also had people who were living alone, who really then had much greater isolation, which became very difficult. But on the flip side, none of us are used to being with our families 24/7. And so that also added some kind of additional stresses to family. And stress is definitely related to depression as well. The other thing was just, some people lost their jobs and their income. They were worried about, housing and food insecurity. We also had, ambiguous loss, which we don't really talk about so much, but, all those high school students who didn't have the graduation parties, people who didn't get to walk across the stage, when they graduate from college or grad school. We didn't have funerals. And as part of the grieving process, that part is so important because you're sharing stories about the individual, right? You're connecting over food, you have the rituals, all of that is really important. And then things like weddings, even tournaments, babies' first birthdays, all of that kind of stuff left us with grief, frankly, which was also, I think, kind of a hard thing. The other thing I would just mention is that we also, for a lot of people, missing touch. I think we didn't realize how much even a handshake, right, or a short hug meant. And then I just, we already know that the statistics about women, frankly, dropping out of the workforce during this time is because distance learning placed so much stress on families, and largely it was left to the women to deal with that. And if you had a child who was in special ed, who maybe had a one-to-one paraprofessional during the day, they didn't have any of that. So you really had families facing and individuals facing an enormous amount of stress. And we also saw that people who had a mental illness before this started, if it was a child, especially young children, telehealth didn't work very well. It's one thing to watch a Disney movie on your laptop. It's a whole nother thing to try to, be with a therapist. Teenagers sometimes did a little better, but they also, depending on your housing situation, didn't have privacy. And so that made it hard for them. We had a lot of people with serious mental illnesses including serious depression, who didn't have laptops, right? And so they were trying to do therapy by phone. So there were a lot of problems in terms of people being able to access the treatment that they needed during this time. So, I would just say for everyone, it's been tough, and we are really looking forward to that light at the end of the tunnel.
Thank
I
you.
also think a little bit not just about depression itself, but also with COVID, is both of them can be very isolating. And so the sense of shame that comes with it, shame being different than guilt, with shame focusing more on there's something wrong with me. And so the silence, that comes from shame, and just going back to what you were saying about the importance of family communicating, not just so people can make a medically informed decision, but also the stigma that gets surrounded by it, the silency and the shame that gets exacerbated by that. And so, same thing with COVID, is there's a lot of maybe shame about how people feel their families might be managing, because of social media. You see lots of people maybe posting that, look, I painted my whole house, I learned a whole new skill, I started a whole new business. I mean, that's not the reality for a lot of people
No,
that don't
most
have
people
that no.
That first couple of weeks when they kind of moved all the kids to home, I saw some of my younger friends putting up on Facebook going, I'm going to teach my kids French because I took
Yeah.
French in college, and we're going to make quiches, and all this kind of stuff. And after the end of the first week, they were like, oh, I can't do this. I'm like, perfectionism, ban it during this time. But, you brought up COVID, and that's the other thing, is the new studies are showing that people who had COVID are actually showing, 6 weeks later, signs of serious depression and anxiety, because we know it's doing something, with inflammation and things like that. So that's the other thing that is actually coming out of this as well. And there was
Right.
actually just a press conference today, just a few days ago, with Senator Klobuchar. So she's introduced a bill to actually do research through NIMH about the impact of COVID on mental illnesses, but also the impact of COVID on people who are already living with a mental illness or developing it new, so that we can really figure out, we've done research on PTSD and things like that, but again, this length of time for so many people, I think we have to look at resiliency, but also, how do we help people through this? Because it's not going to go away just when we open up.
Yeah, and I think that takes us to our natural next question, which is how do we treat depression? So, what are the treatments? So, of course, there's medical treatment where they can take medications, but there are so many other therapies and treatments that are available. I want you all to talk about it, keeping in mind that, when it comes to mental illness, it is generally considered as a weakness. So if some person has diabetes or high blood pressure, the advice you would give that person is, hey, you need to take your medicines, you need to go to the doctor. But if somebody has a mental illness, the expectation is, hey, just snap out of it, just go for a walk, just sleep over it, just eat right, you'll be fine. So what are the treatments for depression?
So you're right. Absolutely. When I think we have to be more vigilant, not as providers, but just people from the community, is just recognizing that people won't talk about these things. And because especially this year, it's been so difficult for so many people. I mean, and in tune with what you have said before, I think especially my elderly patients haven't reached out to get their medical care because they were afraid of going into clinics, and they didn't feel comfortable talking by phone, and video visits were out of the question for a lot of people. And so really, asking about just basic self-care, basic things that they are doing or not doing, taking medications, taking care of themselves. But first and foremost, being vigilant to what's going on with people around us in our community, and asking them. And I think primary care doctors are the first line for us that people will reach out to. And it's becoming more and more common now for primary care visits to be screening for depression or anxiety. And that's really good. We've been trying to have that happen for a long time, and it's become more as a part of the routine now. And they'll give you questionnaires, they'll ask about isolation, they'll ask about violence at home, which by the way, also has increased during COVID times because everybody is at home and there's no space. Nobody has, any space from each other. So primary cares do screen for depression nowadays. And so that's the first line, is, having them find out what's going on in terms of their mood. And if they've known the patients for a long time, they'll be able to say, hey, this is different. But after that, if they feel like things are more severe, then they refer them for either therapy, probably therapy first, depending on the severity, or then we get, as doctors, we get referrals from the therapists. If the therapists feel like, okay, this is something that actually needs medical treatment by medications, then they'll refer them to us. And we always encourage, therapy and medications going hand in hand, because that data is really robust for us to show that that's the most effective combination of treatment for depression. I can talk about the medication piece, that there are, antidepressants that are out there, which I want to say, people will say, antidepressants, they'll feel like they might be addictive, or they might be, tranquilizers. A lot of people have misconceptions about those antidepressants, but there's various classes of antidepressants. But we do, like to educate people about what they are like, how they'll feel once they're on the medications. This is something you have to take daily, just like you would take something for high blood pressure. And then in just explaining that this is a biological illness, and the neurochemicals that I talked about before, the medications are really just trying to increase transmission in those pathways in your brain that affect mood or regulate mood. So we'll offer them, there's different categories of medications. The most commonly studied and prescribed are called SSRIs. And so first job is really educating about what medications do and how you have to take them, how long they take. One of the the key things about medications is they take up to 4 to 6 weeks to actually start working. And so I have a lot of my patients be on medications that have been started by the primary care doctor. In 2 weeks, they didn't see any improvement and they stopped the medications. On the flip side, there are people who have been on medications for a couple of months and they've started feeling better, and they think, okay, I'm better now, so I'm just going to stop the medication, and then those symptoms come back. So, really importance of taking it every day, taking it at least for 6 to 8 weeks. But once patients come to us with really clinical symptoms of depression, we say at least 6 months to 9 months on the medication, and then we kind of reevaluate. If it's a chronic illness and we've seen depression come and go throughout their life, but it's been severe and debilitating, then I might suggest staying on the medication for much longer. Otherwise, we can try taking them off the medication and seeing how things go and continuing therapy long term. So there's various options with medication, and it really depends on how the depression presents in an individual, because everybody's different, everyone's biology is different, everyone responds differently to different medications. So just because one medication worked for your friend or worked for somebody else that you know doesn't mean that that's going to help you. And that's really what the education process is. But I think therapy is a very essential component, and Sonal can probably talk more about that.
Yeah, thank you. So I sometimes use the example of somebody, let's say, living in the desert who has never lived in Antarctica or vice versa, is you can't conceptualize always what you don't see. And so to just introduce that to somebody like, this is what it is, you just have to accept it. It's like sometimes that can be too overwhelming for the mind. So I think that, approaching it from this side about take small steps towards what does it look like to shape a person's behavior. And I think that can be a multifaceted approach, and especially for individuals who may be resistant to certain, let's say the psychotherapy type of interventions, is at least starting to make dents in areas such as checking out their physical health. Is there conditions going on with like cardiovascular stuff, with thyroid issues, with vitamin D levels that could contribute to a small piece of that variance that still we could treat, that could help improve functioning a little bit. I think also taking a look at, um, behavior is influenced by social and cultural norms, so that there is also a responsibility for all of us personally in our private lives to be able to, um, challenge any types of myths, reduce stereotypes, address misconceptions, and to be normalizing the ability to have this discussion. That includes the ability for us to use certain language, like, I'm sad, I had a difficult day, and that still gets to be okay, for us to exist. Sue, go ahead.
I was just going to add some of the other things that I think are helpful is, families struggle with what to do, right? Maybe your teenage son is sleeping all the time and you think he's depressed, and kind of yelling at them to get out of bed isn't really going to work. It's not, they're physically feeling this. And so one of the things we always suggest is to try to take a walk. So, walking and moving, gets the endorphins moving in the brain and can really help. And the other thing is when you're walking side by side, it's kind of like the best time to talk to your teenagers is in the car, because you don't look at each other, right? And so you don't have to look at each other. You can have those kind of discussions in a little easier way. And same with walking side by side. You can kind of talk about how someone's doing, but you don't have to look at each other, and you're walking and you're moving. And so to really kind of think about those kinds of things and to offer kind of that support and empathy, because it's not the person's fault. And so we need to make sure that, we're bringing people meals, that, we're sending flowers and get well cards, and that we're reaching in, not waiting for them to reach out. And just to kind of do those things. When someone's really depressed, they're probably not cooking well. Frankly, they're probably not even going to the grocery store if it's an adult living by themselves. So kind of providing those additional supports like you would if they had cancer or heart disease or something like that is also really important.
I think coming back to the idea too of just simple validation is people don't, sometimes it's like, what can we do? It's just to coexist with it. We can't, do somebody's mental health work just like we can't do somebody's physical health work for them. And so sometimes being able to have that non-judgmental atmosphere, I think goes a very long way, is, not saying like, okay, well, you need to be trying harder, like Sue was saying, like, yelling at somebody. There's research that shows this concept of expressed emotion, they call it EE for short, can have negative implications for mental health therapy when family does not support the individual with mental health, or in fact makes certain types of comments. And people with depression tend to have this threefold view that, they feel hopeless about themselves, about others, and the world. And so, instead of trying to attack it all at once, what are small areas that you can kind of work towards as well? So
There were
Yeah, I
these great
think
cartoons. Oh, sorry.
baby steps are really important. Like Sue said, someone with depression, everything can be overwhelming, right? So if you're telling them to do a lot of different things at the same time, they're just going to shut down and think, okay, I knew that I couldn't do it, and it's just going to perpetuate their feelings of hopelessness and helplessness. So like Sue said, just being active, especially during COVID times. We've lost structure. We've lost our routine. Everybody has. Kids have too. They have online classes, and they don't have to get up at a certain time. They can maybe get up much later. Maybe they can, they don't have somewhere to be or something to do, a task they can determine. And people who are not especially kids, if they're not self-driven, that can lead to a lot of procrastination, and then things don't get done. They're not spending enough time outside. They're on their screens, and same goes for adults. We don't have our routine of getting up and getting ready and going to work, or even getting up, getting ready, making breakfast, getting the kids on the bus. Whatever it has been, our routine has been disrupted. So I've been encouraging my patients to just stick to some kind of routine, even if it's small things like getting up at the same time every day and making breakfast and making sure that you're taking care of your own basic needs. Brushing your teeth and showering. You can imagine that even that has been difficult for some people who are living by themselves, and maybe they're working from home, or maybe they've lost their jobs. They just have nothing to do. They can't go outside, meet people. And even simple tasks like Sue said, taking a walk, getting outside once a day, even if it's to go to the mailbox and coming back. It's small things. If you tell them you can take baby steps, it's much easier, and they feel like, okay, I've accomplished something.
I was
Yeah.
just going to mention, I saw some cartoons. So they had someone, they were, bleeding, and they said, you need to try harder. And I was like, well, you would never say that to someone bleeding, right? But we do say it to people who live with depression all the time. So they just kind of, have these statements that, again, we would never say, it's not working if you're just lying there to someone hooked up to an IV. Well, we would never say that. But so
Right.
just kind of think about what you're saying. And if it was any other illness, would you say the same thing?
Right. Yeah. I think those are all great points that you all shared, especially for parents or caregivers who are taking care of elderly, or even, women who just had a baby, for example. In normal times, that is so stressful. And during COVID, it's even threefold. So one thing, and again, this is because during the last 9 months, as you know, AshaUSA has a mental health matters program, and parents do communicate with us, ask us about resources, and it has been at least 2 or 3 times, and these are South Asian parents who frantically give us a call saying, "Hey, I know a teenager who's really suffering right now." And as we know that, it's not only that lack of in-person school where they don't get to see their teachers and friends, and as we all know that during teenage years, high school years, friends are the most important people for these kids. So lack of socialization, isolation in a room where they're just looking at a screen all day, and so many factors. And what even in the media, and we have seen that suicide rate has gone up for that age group and young adults as well, because as Sue, you mentioned that ambiguous loss and that loss of meaning, because your work and your college life or school life is your life, and suddenly that is all lost. So suicide rate has gone up, and so these parents frantically called saying, "Hey, I need to get help for this teen." So what we've realized that people wait until the last minute. Sometimes they wait until things get so bad that it is like run to the ER kind of a situation. So definitely people need to be more aware of these symptoms, and try to take care or try to get help before it becomes too late. um, Same thing with seniors, as you mentioned, it has been a very isolating experience. You already mentioned some of the things family members can do, but can you think of any more things that somebody who is a part of the family, whether it is your child, whether it is your parent, whether it's your spouse, your sister, brother, anybody, or maybe a close friend who is showing these symptoms? So what can people do? So you talked a few things about what they can say, but what are some of the other things that they need to know and do? uh, can you add to that?
Well, again, I think reaching in is really important. When you're depressed, calling someone else is just not on the, it's just not possible. So, calling people, texting them, dropping stuff off at their house, if you can't go in. And the thing that I would tell parents though is that whenever it doesn't matter, whenever something happens to your child, you know, whatever illness they get, including depression, you feel like it was your responsibility, that you caused this in some way. That's just being a parent. And so I think that's why sometimes parents are afraid to share that maybe they think their teenager is struggling because somehow maybe they were parenting wrong. And we just need to get rid of that, right? It's not because of your parenting. And so, just know that this is a symptom you should address. And also recognizing that, your elderly parent, who maybe isn't as good on an iPhone, is probably too depressed to pick up. And so you're going to have to go to that window. Soon we'll be able to be with them in person, which will be great. But you need to not back off, I guess. You need to kind of be kind of out there and up front with them and just not let them disconnect. I think that's a big thing, because if you're expecting a response, there was a story that this young woman wrote, and she said she was just so depressed. She never picked up her phone. And one of her friends texted her every single day and just said, thinking about you today. Here's a picture of a kitten. Here's some flower, here's a picture of flower. She just texted her every day. And one day she felt strong enough to actually respond. And she said, your text, even though I didn't respond, were a lifeline to me. And so, don't give up on people.
Yeah, I think that's the number one takeaway, is that be persistent with people who you think have somehow changed, or they're not responding to your text, or they're not responding to group texts like they used to, or they're not leaving their home as they were before. Just be very persistent in reaching out to them and just telling them, hey, I'm here, I'm here. How are you? They may not respond to you. They may say, oh, everything is fine. They may not tell you anything. But if you're persistent with reaching out, and if you really are close to this person, you can sit them down and say, hey, I'm worried about you. You don't seem like you used to. There's something different. What's going on? Is there something I can do? And sometimes I've had friends bring in patients to see, because you just need to say, well, can I sit down and make that call for you? Is that, would that help? Can I make that call to your doctor, or to, to find a therapist? Can I do some research for you to get you some help? Or can I accompany you to the appointment? So these things, just some tangible things that you can suggest, and that, goes beyond the point where actually someone has actually agreed that, okay, I need some help. You can do things like that, because everything is hard when you're depressed. Everything seems impossible. And to the point that Saili, you made before, I personally have got a lot of calls from the South Asian community. I know that that's one of our target audiences here is, and I would agree with Sue, is that parents don't share when there's things that are not going well with their kids. They feel guilty, they feel shame, and especially in our community, that's huge. You're the first person to share your kid getting an award, or your kid getting an A, or a kid getting into a good school. But when they are struggling, nobody shares. You can be the best of friends, but nobody will share that. Nobody will talk about it, because they'll feel that there's something wrong in what I did, how I raised my kid. Why are they like this? And so I would really encourage, communities, especially the kind of communities who, and there is a big stigma and they don't reach out for help. I would really, I really wish this would change, that people would come together and talk about their struggles too, and not just their successes. That would help so much.
I would also say, the biggest thing that I've seen working with these kids in our Southeast Asian community is the parents also need to be willing to do the work. It's not just, and vice versa. It always occurs in a system. And so, a lot of these adolescents are also looking at things that are happening, are facing depression and stress because of certain things happening within the home, such as dynamics. And so, we can give tools for an individual to change, but if they go back into that same system where there's that expressed emotion or criticism, or there's a lot of that, kind of push for success without, validation and acceptance of where a parent currently is. I hear a lot about academic pressure and the relentlessness of that. and the difficulty about not being able to say, school is hard for me, or I feel overloaded, or my mental health is difficult. It's like, in our society increasingly, and even within our community especially, is you're supposed to hold this increasingly larger plate of things to do that's just not sustainable or workable for anybody. And so I think, parents also need to be able to be willing to take a step back and take a look at what are the messages and behaviors I'm communicating to my child, and how can I also be better able to have and model emotional based discussions. Is, a lot of people in the South Asian community are, if they're first generation immigrants here, and their children are second generation here, they're not used to saying things like, it's okay to be sad or something, and be like, well, why are you sad? You have everything. And so again, we want to avoid that invalidating perspective, and being able to model better family relationships and communication too, I think is critical.
Yeah, those are all very important points. So there are individual factors. There's biological susceptibility, genetic history, but at the same time, there are psychosocial factors, the family environment, relationships, how people behave with each other, and the external factors in the outside world, which we all are facing firsthand. And we've talked about it. So I think it's so important to treat mental illness, treat depression just like we would treat diabetes or cancer. So if a friend has cancer, we all know what to do. Now, in the olden days, maybe that was also a taboo topic where people didn't talk about a disease that they had. But now, if people have cancer, they have websites talking about every little detail about their cancer treatment. So, but when it comes to mental illness, we don't know what to say. I want to share a personal story. Like, I myself suffer from clinical depression since I was a teenager. And I have taken therapy, I've taken medication, but 5, 6 years ago, when my dad passed away, I had a very bad bout of clinical depression, and I knew there were a handful of friends who reached out to me and who were there for me throughout. But the most common response was, we don't know how to talk to her, we don't know how to support her, or they just kept silent, and that doesn't really help. So even if there are two people, two friends who can be of that support, it's a big help to come out of it. So I can definitely talk from my personal experience. And so I think we are almost to the end of the hour, but if you want to share, each one of you, any parting thoughts or any resources that you think we should know about. And after you are done, we will end with a small 5-minute video clip which talks about managing COVID-19 and depression.
I'll just mention that NAMI Minnesota has tons of resources. I mean, fact sheets about the illnesses and medications, how to navigate the mental health system, free peer-led support groups, including for parents of children, free classes, things like that, that I think could be really helpful, and suicide prevention. And we actually have a class that goes into the high schools called Ending the Silence to help students do that. And I would just remind people, and I would really encourage parents to put this number up on the refrigerator. But if someone is, especially teens who don't make phone calls, if they're struggling, they can just text MN for Minnesota to 741-741, and they'll be connected 24/7.
I would just, my message would be, keep reaching out to people around you, checking on them, even if they're not saying anything. If you know that, you notice something different, don't give up on them. Keep checking in on people around you, and make sure that you don't stop doing that.
I would also lastly just say that, it's important that two things aren't incompatible. So mental health is not incompatible with, a person who has value, who has integrity, who's capable, who has meaning, who can function productively in society. Is that, so I think there's so many splits that people make towards that. But the more that we can all just do our part, to challenge things, and it'd almost be surprising if people didn't have depression or anxiety during this time period, because that's a normal reaction. I've had my own depression and anxiety about, what if this, what if that. just during different environmental periods, like the election and all sorts of different things. It's, about the vaccine. How long is this going to last? Is there going to be a vaccine? It's just so common. And I think the more that we can, address how common it is and that it's a very normal response, the better, it's going to be.
And to realize that, to add to that, you don't have to suffer. There's help out there. There are resources. There's treatment. Depression is treatable just like any other chronic illness. You can manage your symptoms and be highly productive and successful. You just have to, tell yourself that you don't have to be suffering.
Thank you. Thank you very much. That was all very valuable information. And I want to thank on behalf of AshaUSA, Sue Abderholden, Dr. Vibha Kurdikar, and Dr. Sonal Markanda for giving us your time today. And I'm sure people will get a lot of important information from this video. And if they have any questions or comments, they will put it in the comments box. So we get to respond to them. And I'm going to make an attempt to put all the resources that you provided on our website as well as underneath this video, so people can access that information. So let's end with this small video, which talks about some tips to manage depression during
consequences of the coronavirus. In my last video, we looked at 6 tips to help manage stress and anxiety, some strategies to help manage feelings of depression. A big challenge right now is staying active enough. A lack of activity can leave us feeling unmotivated, with low energy, and even depressed. And when we're feeling this way, it's even harder to get ourselves to do things, so it creates a vicious cycle, where the less we do, the worse we feel. And then the worse we feel, the harder it is to get ourselves to do anything. And as a result, we end up feeling even worse. Behavioral activation is a tool that helps us improve our mood by increasing our level of activity, by doing things that give us a sense of accomplishment, of pleasure, and of feeling connected to other people. Now, finding a way to do all of these types of activities is more difficult now, but it's still important that we incorporate these into our lives. Now, we don't need to be that ambitious. Even simple things can help. Getting some work done around the house or taking care of tasks we've been putting off can give us a sense of accomplishment and make us feel better about ourselves. And regardless of what's going on in the outside world, there are lots of pleasurable activities we can do at home, like doing something artistic or crafty, or learning a new skill or hobby, or taking an online class, or trying out some new recipes. These can all give us a sense of accomplishment as well as pleasure, like my latest pandemic hobby of learning how to bake sourdough bread, which has been both extremely fun and rewarding. And being more active helps bring more structure to our lives, which is something that's missing for a lot of us now. And by scheduling in these activities in advance, we make it more likely that we follow through with our plans, instead of not knowing what to do with our free time and just defaulting to binging Netflix or spending all day on the internet. And planning things in advance also gives us something to look forward to, which can be a big help in improving our mood. And a lot of people are feeling lonely and isolated right now. So it's really important that we find ways to incorporate social activities into our lives. Whether it's in a backyard with plenty of room to distance ourselves from each other, or going out to eat on a patio if that's something you're comfortable with, or just going for a walk with a friend. But once winter comes, a lot of these types of things won't be an option anymore. So even if Skyping or FaceTime isn't quite the same as seeing someone in person, it does give us a chance to spend time with our friends and family virtually face-to-face. And there are plenty of ways to socialize online these days, whether it's holding your board game night on an online platform, or hosting your book group, or even a dinner party over Zoom. So make sure you find some physically distant ways of spending time and doing things together with your friends and loved ones on a regular basis, because too much isolation can leave anyone feeling depressed. With so much uncertainty these days, it's easy to get caught up worrying. Now, if you're worrying about catching COVID-19, there are things you can do to limit your risk. So do these, but worrying on top of that isn't going to help and only going to stress you out. And worrying about things like how long this will last or what the future will bring isn't productive, because nobody has the answers to these questions right now. And so your worrying won't help you solve anything and is only going to feed back into your anxiety. And it's also easy to get caught up in ruminating about how much our lives are suffering and how unfair it all seems, and how hard it can be to cope with everything. But ruminating and getting stuck in our heads, going over and over all of the things that we're upset about, is exhausting, and it has a negative effect on our mood and can even leave us feeling depressed. And for some strategies on how to get out of your head and start worrying and ruminating less, check out the playlist that I linked to in the pinned comment. And a good way to avoid worrying and ruminating is to be more mindful. We don't need to do anything special in order to practice mindfulness. Anything we do, we can do mindfully by simply bringing our full attention to it. And the more we pay attention to what's actually going on in our lives, the more enjoyable whatever we're doing tends to be, and the less likely we are to find ourselves stuck in our heads, worrying or ruminating and making ourselves miserable. And although we don't need to meditate in order to practice mindfulness, just taking a few minutes throughout the day to pause and follow our breathing helps keep us grounded and brings us back into the present. And with all of the negative things that are going on right now, it's important that every day we try to recognize some positives or good things that happened. Martin Seligman, the founder of positive psychology, notes that we think too much about what goes wrong and not enough about what goes right in our lives. And this focus on negative events sets us up for anxiety and depression. One way to keep this from happening is to get better at thinking about and savoring what went well. He recommends an exercise called 3 Good Things, where at the end of each day, you take some time and write down 3 good things that happened, regardless of how small or insignificant they may seem. Now, this might not seem like much, but research has found that doing this exercise for just 1 week can increase happiness and decrease symptoms of depression for up to 6 months. Once we start looking for these things that go well, it's more likely that we find and notice and appreciate them, which goes hand in hand with being more mindful. And the more positive experiences we're aware of during our days, the better our days are. And finally, make sure to practice self-care. With fewer things to do in our spare time and less structure in our lives, it's easy to be sedentary, eat and drink out of stress or boredom, stay up too late, or fall into any number of bad habits. But with so many things outside of our control, it's important to focus on the things that we do have some control over. Getting some sort of regular exercise, even if just going for walks, is important and helps us feel better both physically and mentally. And make sure to have a supply of healthy foods on hand, which can take a little more planning these days, to make it easier to eat well. And do your best to get enough sleep. And if you do struggle with insomnia, try to stick to a regular sleep schedule, even if your time is more flexible these days. And make sure you take time to relax, unwind, and do whatever you can to help manage your stress and anxiety and mood before things have a chance to build up and become overwhelming. And you'll find my video on how to manage stress and anxiety during the pandemic below or in the description or pinned comment.
I hope people find that video helpful. So on this positive note, let's end this session. Thank you very much.
Thank you.